Hi guys, I'm Michelle from Virtual Hand Care, and in this video, I'm going to show you how to apply tape to your forearm to increase your supination or palms up position. And you can use muscle aid tape or kinesiology tape or rock tape. I will put a link below of where you can find some tape, and you're gonna need yourself a good pair of scissors. Now, before we do get started, make sure you wash your whole entire forearm and even up past your elbow just a little bit. And also don't apply any kind of lotions or creams before you apply the tape. You wanna make sure that it sticks well. Now, I have applied 3 dots over my radius, and you can do that to your arm as well. It can just provide a nice reference point for you so that you know where exactly to place the tape at along your radius. Okay, step number 1 is to measure how much tape that you need. Depending on the length of your arm and how swollen you are will really greatly influence how long of a piece of tape that you need. But what you want to do is take the tape and just roll it along your forearm. You want to place it from your fingertips to about the crease of your elbow. And if you have blocks on the back of your tape, that's about 8 blocks for me. Again, that might be a little less or a little more depending on your arm. So you want to go ahead and cut that tape. And then what you want to do is round the edges. So I always like to just take that tape and round the edges so that it will stick on and that those edges don't get snagged on anything. Okay, so we have 2 ends now that are nice and round. Okay, and so then what you want to do is tear the paper backing, and you want to do that at one of those blocks. That's about 2 inches into the tape. That's gonna serve as your anchor piece. Okay, and then what you wanna do is just kind of pull that, and that will help that paper come off. Make sure you don't touch the tape as much as possible. It will just help it stick better to your skin. So you can rest your arm on a table or rest your arm at your side. You're gonna go ahead and place your arm in as much pronation to start as possible. I have a red dot here on the top of my radius, and that's really where we're gonna be starting. But the tape is actually gonna go on the outside of our arm. So I'm actually going to be placing the tape on the top of my radius right here, kind of where I have that little red dot as a reference point. So you're in as much pronation as possible, and I am applying the tape over the top of my radius and my ulna, okay? And you wanna rub that in. Sometimes you might need an extra set of hands and ask somebody to help hold your forearm in pronation if you don't have that much pronation. And then you also might need somebody to help with these next steps to help you go into supination. Just sometimes having an extra set of hands can be helpful, but if you don't, you can definitely apply this tape by yourself. Okay, so then what you wanna do is give that tape just a little pull, just so that you can kind of get that paper backing a little bit loose. Now, this is where we really start going into that supination. So remember, the anchor piece is applied in as much pronation as possible with no stretch. Now, what you want to do is you want to rotate in as much supination as possible. And we're going to pull and rotate that tape around our forearm at about 50% tension. Keep that supination, and then we're gonna pull, and so the tape is helping to pull our arm into some of that supination as well. We wanna make sure we go to that red dot, pull, make sure you're still in that as much supination as possible. And again, we really wanna make sure we pull that tape as we start to get on top of that radius again, heading towards that 3rd little reference point. So the top of our radius at that radial head. So again, rotate in as much supination as you can, pull that tape over to that reference point in 50% tension, really try to get the top of that radius. And then what you wanna do is relax your stretch and then just lay that anchor piece down. So just like what you did at the top, the starting point does not have a stretch and the ending point does not have a stretch. And so go ahead and just kind of rub that in. And so as you relax that arm, you should feel a little springiness happening. You should feel like the tape is helping you get into some supination. And in fact, if I go to try to get in pronation, I'm feeling a little resistance. My forearm wants to go into some supination. Now, really make sure when you're applying the tape that you have space between the tape. As you can see, I have some space right in through here and in through here. Now I could have moved this up just a little bit higher just to give a little more space between that tape application right down here, but I'm happy with it because the tape is not overlapping or touching. Because you're applying quite a bit of tension, that tape will kind of constrict. And if you tape all the way around and overlap that, we really don't want to be cutting off your circulation. So do make sure that you have some space or a little gap between the tape lines. Now, ideally, you'll want to wear this tape as long as you can, as long as you're not having any kind of increased swelling, increased pain, or any kind of skin reactions to the tape. It can stay on the arm for a couple of days, and you can shower with it, you can swim with it as well. So now that you have the tape on, you really want to work on activities and exercises that further encourage more forearm supination to really utilize that tape. Now, I hope you found this video helpful. If you did, please give it a like and don't forget to hit that subscribe button below. And if you're looking for some exercises to do with the tape to help increase your forearm supination, then check out more of my videos here. Until next time, thanks for watching.